I'm Dr. Nairizi. I'm board certified pain specialist. I'm the president of Reno Tahoe Pain Associates and United Pain Urgent Care in Reno, Nevada. Lower back pain can be complex, but our expertise is to identify what the real source of the pain is. We're here to talk about sacroiliac joint pain. The sacroiliac joint is the largest load-bearing joint in the body that transfers the weight and the pressure from spine down to your lower extremities and legs. So if the joint becomes dysfunctional, it can create significant pain in some patients.
My name is Diana. I live in Gardnerville, Nevada, which is right down the hill from Lake Tahoe. My back pains probably started in about, I would say 1995 or so. And I've had lots of doctors over the years, tried lots of medicines over the years, and nothing really seemed to work. The pain was there all the time. It basically never went away, even with medication. It was worse if I was sitting for a long time or if I was moving around, walking, standing in a concert, something like that.
So people who suffer from sacroiliac joint pain, they typically present themselves with the pain that is in lower back and can radiate down to their buttocks. In some situations can go into the groin, their hips. We expect that people who suffer from chronic lower back pain, 15 to 30% of them can suffer from sacroiliac joint pain. So we have this in mind and how we can diagnose the right treatment and the right pathology for the patients. First, it starts from your presentation. But we don't stop there. It comes with our physical exam as well. And that means first, we point to the area of where the pain is. And that sometimes you put your fingers right over the buttock area. We will do provocative maneuvers just to basically see if we can aggravate the pain. Then we proceed with imaging and some diagnostic tests. And after that, we do injections into the joint. So we do expect if the joint gets numb, the pain subsides. If that's the case, can be very much diagnostic for us. For patients who still suffer from sacroiliac joint pain despite trying conservative treatments and injections, we do offer a minimally invasive procedure or surgery, which is sacroiliac joint fusion.
I had my procedure in September, my first one, and then my second side I had done in January. And both sides are just doing great. I'm so much better than I was before, so I'm so glad that Dr. Nairizi suggested this procedure.
The surgery itself typically is an outpatient procedure. It takes approximately 1 hour to perform the surgery, and the patient can go home on the same day. When our patients are fully recovered from the surgery, we do expect them to have improvement in their quality of life. And that can be simply from going to the movies. They can sit longer period of time, or lifting their kids, or spending some time with their family, going out. So it can be from very simple activities that you were not able to do and now you're doing it, to more can be in the sports that they want to do that they were not able to perform before, or traveling. So for people it's different, but at the end is to improve your quality of life.
We can go for walks, and we can go to shows, or we can go to concerts, or we can go to games, and I don't hurt going upstairs. I don't hurt the day after for 3 or 4 hours and have to ice myself up and those kinds of things. So that's probably been one of the best benefits of the surgery. Another one that I've been able to do, and it's so much easier now that my back doesn't hurt, is work out in my garden. And I can work out there now, and I can bend over, and I can dig, and I can do those kinds of things. It's almost like it was when I was, 50 years younger.
If you or any of your loved ones suffer from chronic lower back pain and suffer from sacroiliac joints, I would like to invite you to come to our practice at Reno Tahoe Pain Associates and United Pain Urgent Care to learn more about your options. We're grateful to our community and our patients who voted us to be the best pain practice and the best pain urgent care in Reno, Nevada.